Hi, I'm Dr. Allred at Allred Dental, and this is your weekly dose of Allred education. Today we're going to be talking about cavities. This is what us dentists are mostly known for, is cavities and talking about cavities and more cavities. That's what we are known for. So besides the pain part, but we'll get to that at another weekly education. Today we're going to be talking about what makes a cavity. I talk to patients about this all the time, so today we're going to put it in video form and we're going to go over it. The good news is that with me not sitting next to you, next to the chair, I actually have beautiful charts and colors and diagrams that can help us see exactly what's going on. So to have a cavity, it requires three things. Number one, it requires you have teeth. If you don't have teeth, you can't have a cavity. So that's the first thing. The second thing is you have to have bacteria. This is bacteria that causes cavities. You get that from mom and dad. You also get your teeth from mom and dad. Some people's teeth are stronger, some people's teeth are weaker. Developmental issues with the teeth can cause them to be softer or harder. And then the third thing is a food source. So sugar is the one thing that cavity causing bacteria like to consume. So the way it works, it's described down here. So we have bacteria, and you consume any form of sugar or carbohydrates. In this example, it shows soda, hamburger, treats, any form of sweets or carbohydrates. The bacteria consumes it and eats it, and it produces or poops out acid. So that's where the acid comes from. And then when you have your tooth that's bathed in acid, it causes a cavity. Eventually it demineralizes the tooth, and eventually it will actually cause a hole. A cavity is like a cave. It's an actual hole where your tooth rots to the point where it becomes a big gap in there. So these three things have to happen, and wherever they cross, that's where a cavity can form. But that's not all. We have something else that goes on in our body. It's this acid level. So there's this magic number when it comes to teeth, and it's 5.5. When you consume some version of sugar, whether that be carbohydrates, soda, candy, whatever, you get the bacteria produces acid. The acid drops the pH. So this means it's very acidic in the mouth. Anything below this red line means that the tooth is actually being eaten away. It's being demineralized. And then as your saliva comes in, and you can see it takes about 20 minutes for that saliva to neutralize the acid and to become basic again. And then once it's above this number, or this red line, you're actually remineralizing. So your tooth is getting stronger again. And so this number is very important. So what we see when people have a lot of cavities is it's usually a soda sipper or somebody with a sugar coffee. They have it on their desk, and every 30 minutes, they're taking a swig, and we're having this exposure. It drops below the line and going, starts getting up. 30 minutes later, bam, we're right back down. And this keeps happening over and over until eventually that hole is formed, that cavity, right? And so that's why when I talk to patients, I'm not saying you can't have these things, but we're gonna have you be a chugger, right? Chug it and drop it and be done. Drink water the rest of the time, so allow your saliva to neutralize that acid. That's how you can keep the healthiest teeth. So now that we understand what a cavity is, where it comes from, how it happens, you have the tools to actually prevent and make your teeth stronger so you can prevent cavities. And then if you prevent cavities, you don't get to see me as often in the chair where I get to get you numb, but we get to see each other on the cleaning side, which is a lot more fun. So take this to your advantage and go out there and just take care of your teeth, smile a lot more, and be happy, and have a great day. Thanks a lot. Bye-bye.